For me, some of the biggest gains have been in the description of anxiety disorders. You can literally go through the criteria and use it as a checklist to help you understand with a family whether and what type of anxiety disorder a child might have, and then that really helps you target strategies to intervene. I think the regulation disorders of sensory processing, there was a huge shift. The DC 0 to 3 did a good job, but DC 0 to 3R is better. The next version will be even better. But that was huge, absolutely huge, and understanding that physiological regulation leads to relational difficulties and behavior that we see that causes problems for the child, and also affects all areas of development, all other areas of development. And the other one that I really think has been helpful is the criteria for PTSD. And the criteria for PTSD are so much more specific for young children. And I think creating criteria for PTSD for infants and preschoolers has made us really truly appreciate that young children can suffer extreme trauma and that they can show us, even though they can't tell us. Another area of DC 03R, which is really significantly different from DSM-4, is axis 2. So in DSM-4, axis 2 is personality difficulties. And interestingly, in DC 03R, axis 2 is about relational difficulties. And it's a good attempt. It's not going to be the final version for sure. It's going to be revised and it'll be improved upon. But again, those axis 2 descriptions of relational difficulties help us look and observe and try and capture what happens between infants and young children and their parents, and understand some of the more negative things that can happen. And then, of course, then put into balance and help us watch for all the positive things that are happening in relationships, and then, of course, in therapy build on that. I think it's kind of cool that DC 03R starts with axis 2 being relational difficulties, because I think we know now in adult mental health that those personality troubles come from those early relational difficulties. And axis 4 is very similar. DC 03R, though, has this amazing, again I'll use the word obsessive, checklist of every psychosocial stressor known to man, almost. And it has this nice list, so you can just simply go through and look and see whether you've missed anything to capture it as a stressor. And it also organizes one to kind of document when the stressor occurred, and you can document whether it's an ongoing stressor or whether it was when it occurred in the past. So it's important to use DC 03R as a companion to DSM-4, because DSM-4 basically just doesn't capture everything that we see in infants and young children. So if you're going to see kids under 4 and a half, 5, you need to look at what's in DC 03R. It will help guide your clinical work.